Hello everybody, my name is Natira Holmes. I'm going to do a presentation for you on my project proposal, which was on cognitive behavioral therapy for veterans with depression. This is an important topic because the suicide rates in the veteran population is steadily rising, and the mental health concern is mostly depression. Most people believe that it is probably PTSD, but it's actually depression is the number one mental health concern. This is a big deal because in the year of 2016, there was the Veterans Health Administration did a research on it, and it found that on average about 20 veterans commit suicide every day. And out of those 20 veterans that commit suicide, only six of them are being seen at the Veterans Health Administration. So this is something that I'm very passionate about. I work at the VA. I'm actually here in my office. So this is something that is very concerning because those that did not go to the VA, so that means the 14 that were left, were seen in the private sector or maybe just weren't seen at all. So we need to be able to identify some of the risk factors for these veterans that are committing suicide. So what I have proposed is, based on the research that I've done, cognitive behavioral therapy has been a very effective treatment for depression and suicidal ideation for this particular population. So what I have found, the 4 studies that I had used to research this, there were different ones. So one of them was the Carlin study. They have the Veterans Health Administration actually has a extensive training for therapists so that they can treat specifically for veterans. So this extensive training took about 6 months for the therapist to be fully qualified to work with the veteran population. So once the therapists received the training, they were able to provide face-to-face therapy for veterans. There was another study by Hopfall that had an online intervention that was actually done here in Chicago at Rush University Hospital. That was an online intervention where the veteran goes online, does CBT that way, but there's also a veteran support group. So their fellow veterans are there giving them support and helping them in that endeavor. Then there is another type of cognitive behavioral therapy called acceptance and commitment therapy. It's also called ACT. It's done very similar to CBT, but the research has also shown that those types of CBT are also effective in decreasing the severity of depression, decreasing the patient's risk for suicide, and it also showed an increase in therapeutic alliance between the patient and the person that's providing the care. So my proposal is to use a lot of the research that I've already done to kind of incorporate my own method. So what I would like to do is have 3 intervention groups. One intervention group will be a face-to-face therapy, where you'll come in and physically be in the room with the therapist. The other intervention would be telehealth, where the patient would come in to the clinic and they would see the provider over either a television screen or a computer monitor. And then there's the online intervention that's much like the Hopfall study, where the veteran will have a support group of their fellow veterans. And then there'll be a control group where that's called adjustment as usual, where basically the veteran would not be doing anything special. They would just go about life as usual. Now for the telehealth intervention, I wanted to mention, since I'm here in my office, this is what the telehealth global med cart looks like. So the patient would be sitting down and be able to see the therapist on one of these screens. So that's something I wanted to show you real quick. Sorry about the mechanics of the video. But so the outcomes would be measured by using 3 different scales. So the Beck Depression Inventory model, we would use that to measure the severity of depression. And in that questionnaire, there's also, I think, 4 questions that ask about suicidal ideation to assess the risk for that. Then we have the World Health Organization Quality of Life scale that measures the patient's quality of life. And then the Working Alliance Inventory Short is used to measure the therapeutic alliance between the patient and the therapist, or the online intervention, whichever one the patient would be assigned to. So the overall objective of this whole project, I didn't mention earlier, was basically to see which interventions are most effective. The research shows that, it's not just the younger veterans that are at risk. Research has also shown that older veterans are, I think in 2016, there was a 65% increase for veterans age 60 and older to commit suicide. So this is to see which methods are more beneficial for certain age groups. And this is also to raise awareness for those that don't necessarily work in the VA, to maybe offer some more extensive training on how to treat this population. My expectation is that the older veterans would probably prefer more face-to-face intervention, and the younger veterans would prefer a more online intervention, or possibly even telehealth. I just would like to mention, recently here at the clinic here at ABJ in Crown Point, we had a veteran that was found dead in the parking lot that had committed suicide. So it is very important that we identify patients that are at risk for suicide. I have provided the Veterans Crisis Line on this poster as well. So if you know someone who's at risk for suicide, or you think that they might need some help, please provide that number for them. Let me know if you guys have any questions during the discussion board. Thanks for your time.